Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Sulfasalazine. Its brand name is Sulfazine. Before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Sulfasalazine. We'll then touch on an example of dosing, and then finish it off with side effects with percentages. I put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So sulfasalazine has a mechanism of action that may be related to its anti-inflammatory and immunomodulatory properties. It has high affinity for connective tissue and reaches high concentrations in serous fluids, the liver, and intestinal walls. In terms of indications or reasons we prescribe this medication to a patient, well, we may see this medication prescribed in the treatment of ulcerative colitis or rheumatoid arthritis. We may see it also used in juvenile rheumatoid arthritis. With respect to contraindications or reasons we would not be able to prescribe sulfasalazine, well, first off, we wouldn't give this medication to a patient who had a hypersensitivity to sulfasalazine, its metabolites, sulfonamides, salicylates, or to any other component of the formulation. If a patient had intestinal or urinary obstruction, they would also not use sulfasalazine. And lastly, it would be contraindicated in patients who have porphyria. Now for an example of dosing with sulfasalazine. So in the treatment of ulcerative colitis, speaking about the prolongation of remission between episodes, we may see an initial dose of 3 to 4 grams per day, orally in evenly divided doses. And we would try not to exceed an 8-hour dosage interval. The patient would adjust based on individual response and tolerance. For an off-label dosage in collagenous colitis, we may see 2 to 3 grams orally, daily, again in divided doses. And like I said, this would be off-label. As with all medications, there are some side effects or adverse reactions that patients may experience while using sulfasalazine, so we'll go over some of those here now. 3 to 4% of patients may experience pruritus or itchiness of the skin, and 3 to 13% may experience a rash. 8% may experience abdominal pain, and 13 to 33% of patients may experience indigestion. 33% may experience a loss of appetite, and nausea may happen in 19 to 33% of patients. Again, up to 33% may experience vomiting, and dizziness seems to happen in about 4% of patients. 9 to 32% may experience a headache, and some patients may experience discolored urine. 3 to 5% of patients may experience a fever. Now for some more serious side effects, we may see agranulocytosis, Stevens-Johnson syndrome, or toxic epidermal necrolysis. Alright everybody, that's all we're going to talk about today with sulfasalazine or sulfazine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. Good for today. Take care.